It is a pleasure to have Dr. Kaspars Losans here with us today. Thank you very much for joining us today. Thank you for the invitation to your center here. I really appreciate it. It's been a wonderful experience being here, getting trained by the group that you work with, the professors, the doctors, and the scientists. And thank you for being in the program.
Thank you for joining us and to learn about method we are performing here.
Well, can you let everybody know, our audience, a little bit about yourself? Where you're from, what you are in regards to your profession.
Mm-hmm. So I am a medical director and head of this international Virotherapy center, and here we are performing virotherapy based on, I would say, revolutionary discovery here in Latvia. The first registered in world virus which beat the cancer. So virotherapy is a method how live virus is educated or trained to find cancer cells in human body, to how to attract to them and then to destroy them. So this is virotherapy, about what we are talking here, and what we are giving lessons and training other doctors around the world.
Okay, so how did you start out in the medical field in regards to your schooling? What is your studies about?
After basic medical studies, I got my post-graduate studies in obstetrics and gynecology. And during my postgraduate studies, I went to oncology clinic as well, and became as an oncogynecologist. And there started my work in oncology clinic. I work as a surgeon in oncogynecology clinic. At the same time, we perform chemotherapy for our patients, not only surgery. So for many years I've been regular oncogynecologist in governmental clinic here in Riga.
So you started as an oncologist. You started as a gynecologist, then you went to training for oncology, and you were an oncological surgeon.
Yes.
Okay. And you did this here in Latvia.
Yes.
Okay. And after that, you started working in the governmental clinics as an oncologist for many years.
Yes.
Okay. What happened after that in regards to you?
And then, for many years, I moved to pharmaceutical industry. I've been working for many companies in pharma until Virotherapy center invited me to look on their method, taking account that I've been trained in both directions. In pharma, what pharma is doing, and in oncology as well. So, and here in the virotherapy clinic, we are combining everything. It's really integrative attention to patient to see what and how we can help.
Okay, as an oncologist, you decided to work for a pharmaceutical company at that point.
So it was a typical and quite wide movement here in Eastern Europe. Many doctors, due to attractive remuneration, moved to pharma industry to serve in different functions, as well at the same time being quite close to medicine, doing certain medical duties in pharma.
How many years did you work for the pharmaceutical industry?
More than 15.
More than 15 years. And you said that you worked for different companies.
Yes.
Pfizer, Johnson & Johnson.
Yes, Novartis.
Novartis.
Yeah, true.
Was there a reason why you worked for different companies, and why didn't you stay in one company at that time period? Or was there a main reason for that?
There are different reasons behind that why I changed the companies, but as you know, pharma industry is not stable as well. Big mergers are going on. Whenever some merger happens, certain part of employees are not in favored position in new company, for instance. So they decide to look for new opportunities. The same happened with myself a few times. Due to big mergers, I look for new opportunities. At the same time, headhunters are working, and if you are performing good your job, they already offer you new, better positions.
Okay.
So multiple reasons behind that.
In regards to your duties in the pharmaceutical companies, what was your day-to-day duties, job description there?
Actually, there were multiple duties depends from company. I've been working for pure sales, for pure marketing, for so-called team leading, for business unit leading, really different functions.
You know, as different in regards to culture, health system, and here in Eastern Europe compared to the United States, North America, when one thinks about an oncological surgeon leaving that to work for a pharmaceutical company, you know, our mentality back in the West or in North America is like, why, and what were you offered? Or it must have been some great offer. But like you were saying, it's commonplace in these countries around here that happens to doctors. Now, my next question to you is, how do you feel looking back at that experience, that training, that job that you had at the pharmaceutical companies? How do you feel looking back now at that?
I would say all the time I had certain attraction to medicine, and I never stopped dreaming that someday I could do more for patients. Actually, being in pharma industry, we perform a lot of good things, especially for patients. For patient, for access to new treatments, to do certain work with governmental institutions here in the Baltics, to persuade them to turn attention for specific patient needs. There have been a lot of work done for patients, even being in pharma. So that made my memories about pharma nice, that we really gave something to patients.
Okay, great. So after your experience with that, now can you tell the audience what it is that your endeavor is, or what it is that you're doing now, and why did you leave pharma, the conventional pharma, to this task that you're doing now?
Here in Virotherapy Center, we are working with outstanding innovation of Latvian scientists. Latvian scientists over decades work out first approved virotherapy medicine called Rigvir, and it's first used in clinical practice. So first virotherapy medicine from which patients are getting benefit today. So, and this is something absolutely different from everything I saw before. We are working with virus who is educated to find cancer cells and destroy them. So imagine, this is something that never happened before. Virus, and usually we, like in society, with name virus, we understand something bad. In this case, virus is helping us. Virus is helping to fight against cancer.
Okay, so when you as a conventional doctor are approached by Virotherapy company, or the company here that you work for now, the International Virotherapy Center, and you hear that there's a virus that's non-pathogenic, but it eats up the cancer cells.
Yeah.
How do you feel about that? Being an oncologist working for pharmaceutical companies, you've seen exactly how difficult it is to get some product, some drug out, all the phases and all the lab and experiments and testing and this and this and this. All of a sudden this company comes and says, hey, we have an injection that has viruses that will do this. What is your first thought in your head? What are you thinking at that moment?
Actually, my first hearing about that was certain years ago. I heard that exists such invention, and being in pharma at that time, I think, oh my God, yeah, it could be, but how it works? It's so difficult to follow. Is it really works? So, and being invited here, from first I started to study. What are proofs? What being done here? And I discovered that huge job really being done by Latvian scientists to get it work. So, and then working here, when I saw the patients and how patients are benefit from this outstanding invention. So I'm totally convinced that it's work. So there are no doubts. Of course, if you ask how to react if you doctor with conventional education and you are pharma employee with some conventional approach, from first it's a miracle. And the majority of people don't believe. At least they hear the word virus. No, from first they can't believe that virus can help. And by repeating, by educating, by showing our experience, by showing case reports, we can show this proof how good Rigvir is and how well it works, and especially to show that Rigvir is non-pathogenic and not genetically modified product. So it's natural with excellent safety profile. No any serious side effects can be raised. So it's like a vaccine. It's an intramuscular virus injection, and virus works immediately. It starts to find cancer cells in body.
Let me go back to the vaccine. It's not really, it sort of acts like a vaccine, but if you compare the vaccines of today with the Virotherapy, the vaccines have other products in them.
Yes.
Some of them are toxic from our studies. And then the Virotherapy product is just the virus itself. Is that correct? The virus on the content of the vial.
It's absolutely correct. There is nothing except this non-pathogenic, not genetically modified virus. Only trained, educated virus which has ability to find cancer cells and destroy it. And after this oncotropic and oncolytic job, this virus is raising great immunomodulating reaction in patient body. So patient immune system can recognize malignant cells and fight against malignant cells by human body reserves.